My blood sugar improved. Yes, it did. They told me. Actually, I have reduced medication and ate bitter melons. Professor Sun, how would you respond to this patient?
Please give me a second.
I am Yongin Jo from Inha University Department of Endocrinology. Korea Diabetes Association presents you with the journey to diabetes awareness through Diabetes 101. Today, we will be talking about oral diabetes medication with two renowned professors. Let's start with the first question from a patient. I've been recently diagnosed with diabetes. I was prescribed with oral medication, but do I really have to take it? Can't I just treat it with controlling diet and exercise? I am worried because I think whatever medication, it's best not to take it if it's not mandatory.
I think this is a common dilemma among patients. I have recently counseled a patient with a similar case. And I notice patients who were first diagnosed with diabetes tend to worry more about this. It's true that even if you are diagnosed with diabetes, if you manage your lifestyle habits, diet, and your exercising habits, this could be enough to manage your blood sugar. In this case, you wouldn't need medication. However, like the patient's case, when you are prescribed medication at your first diagnosis, I assume that your doctor has considered recent conditions such as blood sugar level at that time or glycated hemoglobin, which reflects recent blood sugar levels. There are many patients who already have very high blood sugar levels at the time of diagnosis. For these cases, it is best to maintain active medication to stabilize blood sugar level.
I also have deep conversations with patients that are first diagnosed with diabetes and have to start medication. I am frequently asked, do I really have to take medication, from them? But when your doctor has prescribed you medication, there must be a reason, such as the blood sugar level is too high. You need to take medication. Moreover, the fact that you take medication now doesn't mean you have to continue it. If the condition improves, we can reduce medication, or you could also move on to try controlling diet and exercise without medication.
What we would like to emphasize is, even after we start medication, lifestyle habits such as controlling diet or exercising habits are very important. Medication and healthy lifestyle habits always must go together.
Let's move on with the next question. Don't you have to take diabetes medication forever once you start? Instead of medication, wouldn't it be better to eat natural food products known to be good for diabetes such as Jerusalem artichokes, bitter melons, or Indian mulberries?
Would this be true? Even if you started diabetes treatment such as oral medication or insulin injection, this doesn't necessarily mean that you must do it forever. You have a lot of experience about this, right?
Yes, I do. However, even if starting treatment doesn't mean it is forever, many patients tend to be very afraid of starting oral medication or insulin. Many of them try eating bitter melons, Jerusalem artichokes.
Yes, they're very interested in natural food products. I also sometimes learn about new food products from patients. I realize the existence of the products nowadays.
I sometimes Google it. They also bring products I have never heard of.
It is true that some of these natural products are effective for lowering blood sugar levels. However, what is important is that many of these products are not clearly certified of whether it's effective to most people, and whether it's safe.
Some of my patients come to me after eating bitter melons and ask if their blood sugar levels have improved. My blood sugar improved. Yes, it did. They told me, actually, I have reduced medication and ate bitter melons. Professor Sun, how would you respond to this patient?
Please give me a second.
I tell them like this. I do think bitter melons are effective for lowering blood sugar at a certain level. However, this is not the case for all patients, only for some, and this is also true for Jerusalem artichokes. What is important to consider is that if those products were effective enough, they would have already been developed into diabetes medication and used widely. It means that these products are not effective enough to be used for medication. They are only at the level of being natural food products.
Many of the professional diabetes medications prescribed by hospitals have passed a lot of clinical research tests. They have certification for effectiveness and safety which is not found in some natural food products, and are only able to be prescribed after approval by the Ministry of Food and Drug Safety.
Aren't some of the diabetes medications we commonly use based on natural products?
Yes, there are.
Yes, that is true, and this is something I am also very intrigued by. Metformin, one of the most prescribed diabetes medications, is based on a substance called guanidine, extracted from the lilac.
That's right. As metformin is one of the starting medications for diabetes, it is also consumed by most patients. Furthermore, there is a new prominent medication recently, and it is also developed from natural products, right?
Yes, that is true. It is known to be based on a substance called florazin, derived from the apple tree skin. Florazin was historically recognized among Native Americans for its fever-reducing properties, and now it is applied to diabetes as it is found to play a significant role in reducing diabetes complications and regulating blood sugar.
Initially, florazin was recognized as an herbal medicine that lowers blood sugar, gaining popularity among the public. However, due to various side effects such as diarrhea, it wasn't able to be fully developed into a diabetes medication. And then, many pharmaceutical companies managed to modify its chemical structure, resulting in enhanced effectiveness, ensured safety, and reduced toxicity. Through this process, it was able to be developed into a diabetes medication.
There sometimes are patients who say that their blood sugar levels improved after consuming natural food products such as bitter melons. How do you explain to them in these cases?
Those patients usually drink water steeped in bitter melon. It's possible blood sugar can be lowered after drinking this. However, as there are medications that are even safer and more effective, they can't be a good enough substitute. I tell the patients it is better to first use diabetes medications.
I also tell them that it is very costly to continue using bitter melon or Jerusalem artichokes. Diabetes medications are affordable, safe, and certified for effectiveness and safety. So, I try to explain to them it is best to take medications instead of these natural products.
Thank you for your responses. Let's move on to the third question. My doctor keeps suggesting increasing the medication because my blood sugar isn't getting controlled. Wouldn't it be difficult to reduce medication after you increase it? I'm afraid I will also have to take insulin injections if I continue like this.
Yes, this can be something very concerning, and it's a difficult problem even for doctors to answer. But when we consider the objective of diabetes treatment, it is not just about stabilizing blood sugar. Due to the chronic nature of diabetes, the risk of various complications that can occur experiencing a chronic disease over extended periods should also be considered. Therefore, it is very important to regulate blood sugar levels and prevent complications that could occur over extended periods. It is ideal to manage to do this with a small amount of medication, but even if this is not the case, it would still be best to stabilize blood sugar and prevent complications through certified medications. Recently, there has been a strong emphasis on the importance of proactive blood sugar management from the start, including options such as early insulin treatment.
Patients really dislike hearing suggestions to increase medication or to start insulin treatment. As they arrive at the clinic, they start saying things like, "I'm so nervous. How is my blood sugar? How is my glycated hemoglobin?" But when I tell them I will increase medications, they feel very burdened by it. However, based on several research findings, rather than gradually increasing medication as blood sugar level rises, it is better to proactively manage medication to appropriately control blood sugar and prevent various problems caused by diabetes. And the concept of insulin injections has indeed changed significantly. In the past, there was a belief that starting insulin early would mean you are already in the advanced stages of diabetes, but this is no longer the case.
That's true. And as we talked about before, diabetes requires long-term management, much like a lifelong companion. Especially in the early stages, the treatment's effectiveness takes a crucial role in the long-term prevention of complications. Therefore, if blood sugar management is inadequate at the time of diagnosis, as Professor Gang explained, it is very beneficial to actively use insulin treatment.
Additionally, it seems that insulin usage has become much more convenient than before. Nowadays, even a single daily insulin dose can get the same desired effect that required multiple daily doses in the past. Moreover, there are non-insulin injectable medications that require a single dose per week and have the desired blood sugar regulating effect. Instead of worrying whether your diabetes has progressed too far, think in a positive way that you can expect better outcomes from proactive treatment.
That's right. It's still true there are challenges in approaching insulin treatment both for patients and medical professionals. However, there is potential for future developments, including the possibility of oral insulin. Insulin that only requires a single weekly dose is in development, and advancements in technologies such as artificial intelligence could potentially lead to treatments that replace insulin, like through the development of artificial pancreas systems. I believe that if patients approach blood sugar management with optimism and proactive efforts, they can pave the way for effective diabetes treatment and complication prevention.
Despite this, if a patient asks with reluctance, "Do I really need to increase the medication?" how would you respond?
I explain that from a long-term perspective, increasing medication now is the shortcut to potentially avoiding the need to increase even more medication or insulin in the future. Now, this is the last question. Why are diabetes medications so complicated, and some tablets are too big that they are difficult to swallow? Would it be okay to break them into pieces and consume them?
That's right. Many of diabetes medications, including Metformin, are prescribed in sustained-release formulation. There are many cases where initial prescriptions for patients include tablets in sustained-release formation, and thus patients tend to feel even more burdened due to the large size of the tablet. So, some consume it by breaking into smaller pieces. However, as this formulation is designed for slow absorption of the medication, it would not be advisable to crush or break the tablet and consume it in smaller pieces.
One of our patients brought their medication bag with them. When they showed me the bag and asked, "Which tablet should I take?" I noticed that there were Metformin and other combinations of tablets inside, and indeed, the tablets were quite large. As I also have difficulty swallowing tablets, that experience made me again realize that the medications I am prescribing to patients are extremely large. Some of you may have difficulties due to the tablet size. I suggest you instead take tablets in the fast-acting formulation. However, these tablets have a downside in that you have to take them a little more often, 2 or 3 times a day.
We hope today's talk was helpful for you to be aware of the correct way to consume oral diabetes medication.
If you found today's video helpful, please consider subscribing and liking.
If you have any questions, please let us know in the comment section.
Thank you so much.